I am currently a pediatric resident physician in Tucson, Arizona. I was asked by Ms. Paula to give a presentation on COVID-19 and children, since it's a big topic right now, especially with everyone talking about the process of trying to get kids back to school. So I'll give a quick kind of overview about COVID, kind of scientific information, and then we'll talk more about the plan as far as going back to school. So we'll start out with just asking, what is COVID-19? A lot of names get thrown around about the disease. So we know that it was a coronavirus that first showed up in Wuhan, China in December of 2019. So it was determined by the epidemiologist that the first kind of transmission occurred from an animal to human, which is not the normal transmission of a coronavirus. So the name of the actual virus is listed there. COVID-19 is the name of what they're calling the disease. So there are two different names that kind of get used interchangeably for this current disease, but the disease name is COVID-19, and that's where they got the name from. And then the name of the actual virus is the SARS-CoV-2 is what they're calling it. This is just a list of past coronaviruses. So when this first broke out, I heard the word coronavirus and I was like, oh, everyone gets coronavirus every year. So the first four, the most common ones they cause the common cold. So every single one of us has had a coronavirus at some point in our life, most likely. The other ones that seem to cause the severe respiratory distress are, if anyone remembers SARS, I don't think I was old enough to know about it then, but SARS in 2003 is very similar to the SARS-CoV-2 that we're dealing with now. And then there was MERS that happened in the Middle East in 2012. That was also a coronavirus. And the difference between the three at the bottom is that they all were, the first transmission seemed to come from an animal to human, which makes the difference and seems to cause a more severe syndrome than the normal human coronaviruses that we all spread to each other. And so the symptoms for COVID-19 can range, very wide range, from mild to very severe. Usually starts a couple of days to 2 weeks after you've been exposed to the virus, and usually can often include cough and shortness of breath. And then at least two of these extra symptoms can also suggest that you have COVID-19. And from what we've seen with the adults here, I'll say the loss of taste or smell is a very common symptom that's suggestive of COVID-19. So who's most at risk? Older adults, which I think everyone is aware of, and then people who have any sort of serious chronic medical condition. And that could be adults or children, heart disease, diabetes, lung disease, including asthma, any sort of heart condition, congenital heart conditions, conditions that weaken the immune system, so like cancer or lupus, and then obesity, which is also a risk factor for other medical problems. So when it comes to children, from what we've been able to gather from early research, children have milder symptoms if they even develop symptoms at all. And fewer children are hospitalized than adults for COVID. However, there has been severe disease in children, and there are children that have passed away from COVID-19, most often seeing it in the really, really young children. So the big question we get a lot is, should your child be tested? Should I get my child tested for COVID? And that your child's particular pediatrician would be the most helpful in determining that, because it's based on the infection rates in your area and the availability of tests in your area. And that they're also a good resource for following up on results. It'd be a lot easier to follow up on results if it's done through your pediatrician office versus just a lab that's out in the community. And so I know here we are not testing kids unless they're symptomatic, just because the rates here for kids are extremely low. So the likelihood of them having it without any sort of symptoms is very low. And so we're reserving those tests for the adults, because we have had a large, I'm probably sure you've seen in the news, a large surge of positive tests for adults here. So we, for our children, have not been testing them as frequently unless they are having symptoms. And so there are two types of tests that you can get for COVID-19. The viral testing is usually the one that you're aware of with the nasal swab. And that tells you if you're currently infected. And so if it's negative, that doesn't mean that you haven't had the infection already. It doesn't mean, without symptoms. It doesn't mean that you can't get infected. So you could test negative one day, and then 3 days later, if you get tested again, it's very well that you could be positive for it. The antibody testing is a blood test. And so that test will let you know if you've had the infection before, because your body has built up antibodies against the virus. So that tells us that your body has been exposed to it and your body has fought it off. But the only thing about the antibody test is that it won't tell you if you have a current infection. It will just tell you that you have had it before. So if you're trying to determine if you've had it and also if you currently have it, you would need to get both tests done to get that answer. And so one of the things, I don't know if anyone's heard about it but one of the things that we've heard about with children with COVID is called multisystem inflammatory syndrome. And it was first reported in the UK in April. Incidence is unknown, but it appears to just be a very rare complication of COVID in children. We actually had our first case here. I was in the pediatric ICU for my last rotation last month, and we had a child that needed to come to us for more respiratory support because of this syndrome. And so most of the cases are in older children and adolescents who were previously healthy. And so that's different from children who get like an acute COVID-19 infection because those kids are usually much younger and they usually have underlying health problems. And so this syndrome is considered more of like a post-infectious syndrome because it shows up about 3 to 4 weeks after the infection has already occurred. And most of these children don't have acute symptoms of COVID when they're infected, but a few weeks later, they develop this syndrome. And it appears, just based on the data we have so far, that Black and Hispanic children are more affected than other races. And there's not a clear reason as to why. And so it's still not very well understood. Like I said, it's thought to be a post-infectious process, resulting just from an abnormal immune response to the virus. And there are other inflammatory syndromes that we know of in children that are also not well understood. One of them being Kawasaki disease. And I don't know how familiar everyone is with that, but it's also considered just a huge inflammatory response in the body. And we don't know what the cause of still is for Kawasaki disease, but this is something that is getting compared to Kawasaki and how it presents in children. And so many of these kids, because it's seen as a post-infectious type process, their viral testing, so the one that will tell you if you're currently infected, is usually negative, but their antibody testing, which tells you if you've had the infection in the past, is usually positive. And that goes along with it being kind of this post-infectious thing that occurs as a response to the virus. But some kids do have both tests that are positive. So the most common presenting symptoms, it's strange because it's not actually respiratory that's the presenting symptom, which is what you would expect with this. But like with our patient, he had the persistent fevers. He had fevers for probably about 4 or 5 days. He had GI symptoms. So he came in with abdominal pain that was thought at first to be possible appendicitis. So he was worked up for that. His appendix looked fine. So it was very confusing as to what was really going on with him at first. He had rash. He had the conjunctivitis. He had the mucous membrane involvement. So he had kind of some sores in his mouth. Neurocognitive symptoms. So he did have moments where he was somewhat confused and was saying things that weren't making sense, was having a headache. And then he started having respiratory problems, which ended up being the reason why he was transferred to the ICU, because he needed just more oxygen support. But he eventually was able to be weaned down on his support and be discharged home. But for that short moment, he needed more support for breathing. But that showed up, a few days after these original symptoms. So the management and all of this is medical jargon, but I just wanted to throw it in there so you could see how much goes into actually working these children up in the hospital. So they get a lot of lab testing done, looking at different markers in the body that would tell us if there's a lot of inflammation, which are usually high in these children. And then because they come with persistent fevers, we always think of infection, the possibility of sepsis. So you get infectious labs. And then down at the bottom here, they get started on empiric antibiotic treatment, which just means that we give them the most broad spectrum antibiotics because we don't know what we're treating yet, just to make sure that we're covering as many organisms as possible in the beginning. Because of all the inflammation as well and the similarity to Kawasaki, there are a lot of cardiac labs that get done. They get echocardiograms, they get EKGs, because there's the possibility of getting aneurysms in the heart because of the inflammation. And so with everything that we're looking into with these patients, there are multiple specialists that get involved. So the infectious disease doctors were involved, the cardiologist. I don't think for our patient we had rheumatology involved because it was textbook for this syndrome. So we didn't think that he had lupus or any other sort of autoimmune disease going on, just because he met criteria for pretty much everything with this MIS-C syndrome. And then IVIG is something that we give, again, similar to Kawasaki's disease, because the idea is that the body is having this abnormal immune response to this virus or this entity. And so we give IVIG, which IgG is a type of antibody that our body has and it lets us know that we've developed an immune response to a virus, to bacteria, so that we can be able to further fight off the disease if we see it again in our bodies. And so we give IVIG because the idea is that their antibodies are not responding appropriately, and is basically kind of having this response against the body. So we give new IVIG to kind of help fight off the inflammation and help the immune system respond appropriately. And then lastly, we gave aspirin as well for this child because it's shown that with any sort of hyperinflammatory state, you're at risk for developing clots. And so aspirin helps to prevent that. And then it's also given in Kawasaki disease. So there's a lot of similarities between what we're seeing with this syndrome and Kawasaki disease. But the demographics are different. So like I said, for MIS-C, the kids are older and they are of Black and Hispanic race, the majority of them. With Kawasaki disease, they're much younger children, and it's more commonly seen in kids of Asian descent. And so the prognosis for this syndrome, most children survive and they do fine. And there's a variety that don't need hospitalization. There are some that do, but the majority of children, regardless, survive, though there have been some deaths reported. In one particular case series, there was a 2% rate of death. I think there were about 400 kids in the case series, and about 8 of them died. 2 of them had underlying medical problems, and the other 6 were completely healthy prior to developing this syndrome. And so we're going to flip sides of this now and kind of talk about school, because I know that's a big question right now, and debate about whether kids should go back to school. If they should, how should that look? And so the AAP, which is the American Academy of Pediatrics, which is a large organization, every specialty of medicine has their American Academy of blank, that has a group of people within the field that provide guidelines, provide guidance, that's well respected within the field as far as recommendations for different things that pertain to that specialty. And so for pediatrics, they released a statement basically outlining what they consider to be important points that need to be focused on and need to be acted on before kids actually go back to school. But the bottom line is that AAP strongly advocates that children do go back to school. And we'll go through these list of reasons why they think it's important for kids to physically get back in school this year. So one, the importance of just being in person and learning is well documented. And we've already seen some negative impacts on children because of them not being in school for pretty much all of the spring. There are things that some kids rely on school for, as far as like food security, making sure they have any sort of physical activity. Sometimes kids get, their only meals at school. Sometimes when they go home, they don't have a safe neighborhood to go play in. So they get their physical activity at school, at recess. And then there's also the part of school where, there are teachers, there are counselors, there are people that can identify any sort of issues that may come up with children as far as concerns about physical or sexual abuse that's occurring at home, substance abuse, depression, suicidal ideation, all of these things that schools have been helpful with identifying for children that may not particularly be safe at home. So these are the main reasons why they're feeling like it's important for kids to physically get back in school. With that being said, I didn't put it all here because it's very extensive, but they have a very long proposed guideline at this link for school reentry. So they're not just about kids just going back to school all willy-nilly. It's very detailed and outlined as far as masks, social distancing, doing block schedules, different things that they could do to make sure that the kids are safe, that the teachers are safe, the cafeteria staff, the janitors, to make sure everyone is safe with this process of getting kids back into school. And so I agree with it. I believe that a lot of kids benefit from being in school, especially those kids that don't have the most secure home environment. But I also believe that everyone needs to be protected, and everyone needs to have a backup plan. There needs to be so many things in place before it actually happens. So that's, if you want to take a look at that guideline, it's at this link, and you can just search for it really at aap.org, and you should be able to find it. And then this little last piece is just about masks and kids in general, but also with the idea of returning to school, there will be masks involved. So a lot of the questions I found in this article from the AAP website that a pediatrician was able to answer, I thought was very helpful. And so one of the questions and common things that you hear is, will they be able to breathe? Because there are all these thoughts about carbon dioxide poisoning and not being able to get oxygen, but that is absolutely false. We wear masks all day long, and we do not have trouble getting oxygen. We are not developing carbon dioxide poisoning. All of that's completely false. So yes, your children will absolutely be able to breathe with the masks on. Recommending that kids older than 2 should wear a mask. And the only reason we're saying older than 2 is because younger children younger than that, there's just no guarantee that they won't take it off, try to eat it, put it in their mouth, touch it over and over. It's just a less guaranteed thing and a less safe thing for the younger kids to try to force them to wear a mask. So we're saying older than 2. Those kids are old enough developmentally to understand why they should wear the mask, and they should also understand that they shouldn't touch it, and they're less likely to eat it because they're, like I said, developmentally just older. And then the question of, what if they're outside? Not necessarily do you need the mask if your family is outside and you're 6 feet away from other people and you're not in a large crowd, but always a good idea to have them on hand, just in case you may not be able to maintain that distance for whatever reason, and you can protect other people by keeping the masks on when you're closer. The mask should fit correctly, so I've even seen adults wearing them inappropriately, just covering their mouth but not their nose. Both the mouth and the nose needs to be covered, and there shouldn't be any sort of gap around the sides, because it's just allowing things to get out, mostly, not so much get in. But there are several places that they listed in the article: Etsy, Old Navy, Crayola, who make adjustable masks. So as they get older, I guess the mask just kind of extends. I've actually never seen them, but it sounds like a cool idea to save money, just to get an adjustable mask that they can continue to use over and over. And then the next question is, how often should the mask be washed? They should be washed every day. So it would be good to have a supply, however many you want, to maybe 5 to 7. So you have one for each day, wash them at the end of the week and use them again. But they should definitely be washed every day. And they're usually going to be kind of damp by the end of the day, just because of all of the breathing, the condensation from breathing. And so how do you get your child to wear a mask? It's similar to getting them really to do anything else that you think is important for them to do. Nothing wrong with rewarding them for leaving their masks on and not touching them. Reward charts, setting up a system in that way, it works really well with kids. And then that kind of leads into kids will get used to it as a statement, because there are a lot of things: brushing their teeth, sitting in a car seat, eating their fruits and veggies that they don't want to do, but you can make them do it. Even if they don't enjoy it, but they will eventually, the more you make it a point that it's important, they will get used to it, and they will do it. And a big part of it is you having a good attitude, and the children will follow. If you're modeling how important it is, you're always wearing your mask, kids will live up to the expectations basically that we put on them. And so you just showing that this is good, this is protecting other people, this is what we want to do, kids will follow suit. And then the other big question is, what if your kids are scared? So a lot of kids haven't been out, they haven't been seeing a lot of people. They haven't been seeing people wear masks because they've been home and no one's wearing a mask at home. Or at least they shouldn't be, they don't have to. So it's just important to kind of maybe get them out, show them that people are wearing masks, show them that this is the new norm, this is what we're doing to protect everyone, encourage them. And like I said, a big part of it is just modeling for them what you're trying to get them to do. And that will take away a lot of the anxiety, a lot of the fear about wearing the masks. This website, healthychildren.org, so we recommend it all the time to parents in all of our visits. It's sponsored, it's created by the American Academy of Pediatrics, so everything on there is supported by the physicians and the groups within that organization to be accurate information. And it has so much wonderful information about anything you would need to know, any question you would probably have about your child in general. And then they also have a very nice section on COVID-19, on a lot of the questions about mental health with kids, children that have asthma, breastfeeding with COVID, a lot of different articles and information that would be super helpful for a lot of parents right now, helping to deal with the new normal that we have right now with coronavirus. And I think that's my last slide. So these are all of my resources, most of them from the CDC and from healthychildren.org. Let's see. And then I leave the floor open for any questions. If anyone has any concerns or any statements that they want to make about anything. I know that was a lot. Tried not to make it too medical, but wanted to also give a lot of background information about what we're seeing in the children. So, I mean, overall, the kids are doing fantastic. Unfortunately, there are still, some that have died, some too many. But overall, at least here in Arizona, we haven't seen a lot of children with COVID-19, at least not with symptoms that we would know about. So I guess I'll close it with, I do find it important for them to go back to school, but I absolutely don't think that can just happen just like that. There's so many things that need to be set in place to make it safe for the children. And I know everyone's focusing on the fact that kids are doing fine with the disease. They're not getting infected as much. And if they do, they have mild symptoms, but there are also teachers at the school. There are also janitors at the school. There are also cafeteria workers at the school. There are people there who are older and are at higher risk of getting infected. And so kids can still pass it on even if they're not having symptoms. And so I think they need to think about everyone that's going to be in the school, even though the children are going to be okay. So that's my thought on that. But thank you guys for tuning in. Just let me know if you have any questions about anything.